mental health needs to be talked about.
You do feel so isolated.
I think it's really important that people's mental well-being is thought about on the same level as the physical well-being.
It can be difficult to ask for help.
My family, like me, struggle to engage with mental health services in general.
Do you know, the thought of my physical health getting worse, the impact that would have on my mental health, that just doesn't bear thinking about.
You know, sometimes people just want to talk about it.
National Voices and Centre for Mental Health have been talking to people about long-term physical conditions and their mental health. We know that people living with long-term conditions are twice as likely to experience mental ill health as everybody else. And we know that for many people, COVID-19 has exacerbated those problems.
We are launching a campaign that asks for all people living with long-term conditions to be supported in their emotional health by all healthcare professionals in all healthcare settings. We know that in some places that is happening already. Many healthcare professionals already provide compassionate care, and no doubt many more want to do so, but are frustrated by a system that can make it difficult. But compassion must be universal. That is why we're launching this campaign.
I care for both my husband and my son.
I live with 2 long-term health conditions.
I've multiple long-term conditions.
I was first diagnosed with renal failure in my early 20s.
When I was a trainee solicitor, my desk was in a room which was moldy and damp. As a result of that, my asthma became worse. I had to make a difficult choice of leaving that place of traineeship.
I started my caring responsibilities in January 2012 when my son was diagnosed with type 1 diabetes. Then in July 2017, my husband was diagnosed with brain cancer. And as a result of his brain tumour, he now lives with severe acquired brain injury and epilepsy.
I had a period of dialysis, and then my sister donated a kidney to me, which is still working now.
Mental and physical health are so intertwined. Like, if I don't feel like getting out of bed and showering and looking after myself, how can I possibly feel like I want to make all of the treatment decisions that I do?
In some communities, mental health problems are rarely spoken about and can be seen in a negative light. This discourages people within the community from talking about their mental health and could be a critical barrier to engagement with health services. My family, like me, struggle to engage with mental health services in general. We receive limited to no support only at crisis point.
My own mental health stigma prevented me from seeking early treatment and care. Once I was diagnosed and was in care, I was very fearful the doctors would take my physical health seriously or not. I was wondering whether they may think I was making them all up.
Part of my mental health story is I went to seek counselling for at a time when I was really upset. I got told that I needed to get my physical disease under control.
While I just had problems with my mental health, the health service could deal with that. When I had problems with my physical health, the health service can deal with that. What they can't deal with is when your physical health affects your emotional health.
I should not be just treated for the illness without taking into account everything about my personal experience, like the environment I live in, my financial and social factors, any extra support that I may need. This will all help with my recovery.
If you break your leg, you go to hospital and you get it fixed. No one kind of goes, oh, you've broken your leg, that's really embarrassing. You know, you talk about your broken leg. And I've always been very open about mental health, and mental health needs to be talked about.
We all have impact on other people, don't we? Yeah, everybody experiences us in a slightly different way. I don't suppose health professionals are any different, really. They've just got to be alive to those signals and skills.
I think that there are some people who hear the question, how are you feeling, and don't know kind of what they can and can't talk about.
What am I really saying? If I say I'm feeling fine, does that mean I push off, I'm not going to talk about it? Or does it mean I'm feeling fine? Or does it mean I'd like to feel fine, but I'm not?
The campaign is called AskHowIAm. It aims to ensure all healthcare staff really find out how people are on an emotional level and that the system provides the time and tools for them to have those crucial compassionate conversations. If people need further help, that too must also be provided. We would love for you to get involved in the campaign. Please pledge your support publicly, promote the campaign on social media, and raise awareness of these issues in any way you feel able. Thank you.